Hi, everybody. I'm Margaret Laws, President and CEO of Hopelab, and I'm really excited to be here today at the inaugural Virtual Behavioral Health Conference. Before we dive in, I want to say a little bit about Hopelab. We're a social innovation lab founded and funded by Pierre and Pam Omidyar, founders of eBay, and we work to improve health and well-being of teens and young adults. Our team consists of behavioral scientists, designers, and technology digital product developers. And I'm here today with my colleagues Caroline FitzGerald and Nathaan Demers, and we're going to talk about an innovation project that Hopelab and Grit Digital Health have done together to tackle loneliness in college students. So I'll turn it over to Caroline and Nathaan, who will introduce themselves and tell us more about NOD.
Thanks, Margaret. Hi, everyone. Thank you for joining our session. My name is Caroline FitzGerald, and I am a project lead at Hopelab. I've been leading this work that's focused on addressing loneliness among teens and young adults for a little over 3 years now. I'll hand it over to Nathaan.
Thanks, Caroline, and thanks, Margaret. Excited to be here. My name is Nathaan Demers, and I'm a clinical psychologist and the Vice President and Director of Clinical Programs with Grit Digital Health. And at a very high level, Grit Digital Health, similar to Hopelab, is a multidisciplinary team living at the intersection of behavioral health and technology. Our team consists of psychologists, designers, technologists, as well as experts in marketing and communication.
Thanks, Nathaan and Caroline. I'm going to turn it over to Caroline now so you can take us through a little bit of the background work on loneliness.
Thank you, Margaret. So I want to start out by sharing what loneliness is exactly, because it can sometimes be confused with being socially isolated. So the definition of loneliness is a gap between the relationships you want and the relationships you have, which causes emotional pain. So you can be surrounded by people and still experience loneliness. And you could also be physically isolated and still feel like you have connections that are rich and meaningful, thus not feel lonely. Next slide. One of the things we're seeing right now is that loneliness is on the rise among youth. This is data from a nationally representative survey called Monitoring the Future, and it shows that the percentage of 8th, 10th, and 12th graders who agree with the statements, "I often feel left out of things," or "a lot of times I feel lonely," has been on the rise since about 2007. And not only is the percentage of young people reporting loneliness on the rise, the actual level of loneliness also looks like it's increasing recently. This is data from a survey recently sponsored by Cigna, the insurer, that looked at loneliness across generations in the US in 2018 and 2019. And what you could see is Gen Z, so young people aged 18 to 22, are actually rating their loneliness the highest among any generation in the US today. And their level of loneliness has actually increased over that time period. So we're concerned about loneliness, of course, because it causes this pain, this gap between what we hope to have in our life in terms of social connection and what we do have. But there are also these risks that loneliness poses to young people's health. So lonely young people are at heightened risk for anxiety, depression, poor sleep, drug and alcohol use, susceptibility to illness, self-harm and suicidality, and they're more likely to leave college before completing their degree. And I'm going to hand it over to Nathaan to give a little deeper perspective on loneliness among college students today.
Thank you, Caroline. So as I think we can all very much agree, loneliness is a very significant challenge among young people. And of course, that graph that showed loneliness very much on the rise, we know that those students and high schoolers who are endorsing those high levels of loneliness are entering our institutions of higher education. So with that, the American College Health Association does a survey every year, and we learned that about 30% of students report feeling lonely in the last 2 weeks, and 67 report feeling lonely in the last year. And one thing that's important, this isn't, I'm feeling lonely because I'm alone in my residence hall on a Friday night. This is more of a profound sense of loneliness. And of note, this was 67% in the 2019 survey. It was 60% 2018. So we know that that is also on the rise. And furthermore, while we started all this work back in 2017, 2018, we also know that COVID-19 has unfortunately also had a negative impact on the mental health of students across the board. We know that 20% of students are reporting feeling more depressed, 11% are reporting feeling more anxious, and 16% are feeling more lonely. And just to couch that a little bit, we also know from research from the Healthy Mind study, the center out of the University of Michigan, that 77% of students, this is pre-COVID, reported that their mental health negatively impacted their academic performance in the previous 4 weeks. So we know that that was already a baseline issue, and COVID, unfortunately, is only exacerbating that. And furthermore, when we actually dig into the data, we can see very clearly that feelings of loneliness and belongingness are very much tied to retention. So this data is from a large state university that does a great job doing an exit survey with every student who stops out prematurely. And they ask students the significant factors leading to their decision to stop out. And very quickly, we can see that 52% were saying that they were emotionally depressed or distressed, 41% were saying that they felt socially alone, and 29% say, I felt unwelcome here, which of course belongingness is very much correlated with loneliness. So not only is there a very significant case for making sure we're addressing loneliness to ensure health equity, as well as supporting the health of our young people, it's also essential to have thriving campus learning environments. And the other thing I really love about working with youth this aged, jumping into college, is that it's a very unique time in the lifespan, both from a developmental perspective as well as environmentally. So we know students are going through a process of trying to become their own being, finding their own identity. And with that, when many students gain this independence, many going away from home for the first time, they also really want to connect and find their people and their friends. So it's a really unique time in the lifespan to intervene, but we also know it's a very significant time of disruption. A lot of students maybe had the same friend groups from K through 12. So with that, when they're all of a sudden leaving that community and maybe going to a much larger, let's say, state school with 7,000 incoming first years, that can actually be a very intimidating experience if you haven't had the opportunity to practice all the social skills that it takes to make friends when you're in a new place.
Thank you, Nathaan. I just want to add before we move on that one of the special things about focusing on loneliness is that we know both it's a predictor of these health risks that we really want to avoid for young people, but it's also a place where there's this high positive motivation, and behavior change is hard. So Hopelab is always looking for these places where we can intervene, where there's positive motivation around behavior change.
Great. Great. So what I'm going to do now is shift us from the background on loneliness, why it's so important as a predictor of these mental health and emotional well-being challenges for young people, and talk a little bit about how we collectively at Hopelab and Grit approach this problem and approach building a digital intervention. So at Hopelab, we use a process that we think of as reverse engineering health. So we think about what a successful outcome would be. We want to see young people having a positive experience in college, making friends, making social connections, and not feeling loneliness and the subsequent bad things that happen. And so what we do is we go from that successful outcome, we think about what are the health behaviors that drive that outcome. Then try to understand what's the psychology, what are the psychological determinants of that behavior, and how might we develop a technology experience that can engage that psychology, that can drive a positive health behavior, that can lead to a successful outcome. And so taking this framework in mind, we began to think about all those different pieces of it. And we had team members working on understanding the behavior and psychology, studying the literature and understanding how loneliness affects and impacts depression, anxiety, even suicide. And then thinking about how young people living with technology might be able to use this technology in a positive way. And we might be able to design an experience for them that could help drive psychology that leads to behavior that leads to this outcome. So what we did was began to look at a number of other factors from design and behavioral science. And I'll turn it back to Caroline to talk a little bit about what that process was like.
Thank you, Margaret. And one of the things to keep in mind, which I think is really unique about our work in this space of loneliness, is there is no go-to evidence-based intervention for loneliness among youth yet. So unlike, for example, CBT for depression, which has well-established efficacy, we really had to start kind of farther back looking at, from a behavioral science perspective, what do we know about how youth who are lonely think, feel, and behave? And what does the social science and intervention research tell us about how to reduce loneliness and what works for building social connection? And then we also had to look at, what is college like today for these Gen Z students? And what does loneliness in college feel like? What are they doing already to try and seek out their social connections? What's hard about that, and what's working and what's not working for them? So all of this research boils down to what we call our impact pathway. This is what really drives the product design and features. So on the left, these are those psychological and behavioral factors that Margaret alluded to that we map in the reverse engineering process. When we looked at loneliness, what we saw were there was kind of 5 key factors that we felt could be targeted with a digital intervention that would lead to these short-term outcomes of decreased loneliness and increased social connection. I'll highlight them a little bit, and then Nathaan's going to go deeper into them actually as we walk you through the nod product. So those 5 are holding realistic expectations about what it means to build social connections in college. And then also believing in one's ability to grow socially, understanding that social connection is a skill, not something that people are inherently either good or bad at. Taking risks. So this is social risks that we're referring to, that willingness to kind of push outside your comfort zone just enough to meet someone and make those connections. And then focusing attention towards others. So when we feel lonely, we can sort of get an inward focus. That means that when we're in social interactions, we don't have that kind of reciprocal experience that allows people to really get to know us and us to get to know them. And then finally, self-compassion. So recognizing that building social connections is hard, and not looking at the difficulty that one might be experiencing with a sense of kind of judgment or self-criticism, but rather kindness and self-compassion that really allows you to have a resilient approach to building social connections. So I don't want to take up much more time because Nathaan is going to take you through the product.
Now the moment we've been waiting for, Nathaan, why don't you take us through the app and show us how Nod works?
Yeah, thank you, Margaret. I'm really excited to. And as great as, turning over all the rocks for the research and interviewing the students, the most fun part is actually building and turning this science and research into a tangible, real thing that we can get in the hands of students. So thanks for letting me present the fun part. So with that, this is Nod. And the way you can conceptualize Nod is it's like a workout app for students' social life. It breaks down the large task of forming friendships into much more manageable pieces. And we'll jump into how we actually do that. So there's 3 main features of the app. There's testimonials, challenges, and reflections. And I'm going to resist the urge to go too far into each of these right now because we're going to jump in just a minute. So as soon as students get to the app, the first thing that they do before jumping in is we give them a quick onboarding orientation. So students sign in, and then we actually give them a quick overview of what those 3 main components are. So again, all about the testimonials, the challenges, and reflections. After that, we ask them to very quickly sign in so that we can collect a little bit of demographic information to help support our research. And then very importantly, students actually rank how well they feel like they connect with others. As soon as a student does this, the app starts to present challenges that are very much in line with their experience. And then secondly, students can actually rank their priorities and what they want to work on. For example, if they want to deepen existing connections or get past the small talk or keep in touch while being remote in our COVID world. So this is the experience that, again, customizes the app, which is extremely important for young users who are just used to that personalization. As you know, our music feeds are personalized. Sadly, our news feeds are sometimes personalized. We have to really make sure we're meeting those digital expectations. So to jump into our three key components of the app, and Caroline and Margaret, please feel free to jump in and add anything at any time. Testimonials are the first really important part of the app. So one thing we heard in our research is that a lot of times students think friendships should just happen magically or happen overnight. So with that, what these are true, real accounts and quotes from students about their fears, their anxieties, their persistence and resilience in forming social relationships. So there's all sorts from different kinds of students. We made sure to get diverse voices in this mix as well. And these testimonials very directly map to two of our psychological targets. The first, as I mentioned, is holding realistic expectations. In our research, I found it fascinating that students reported, I know I have to put a lot of thought and time towards maintaining my family relationships. It takes a lot of time and thought to maintain or build a romantic relationship. But when it comes to friendships, that's something that should just happen. If I tried, it would feel really weird. And we really need to dispel that myth. And then secondly, we also really need students to believe in their ability to grow. That's where those stories of resilience from students come in. Developing a growth mindset is essential. Just because a student does not have those skills when they're first starting off doesn't mean that they can't put in the time and effort and grow in that department to get the relationships that they would like and desire. Anything to add, Caroline or Margaret?
Nope.
All right, well, I will jump into the second part of the app, which are challenges. So this is where we really encourage students to get out into the real world and test out these skills. So all of these challenges are really based in social science and great ways to connect. And we break them down into very small steps. So rather than a student feeling like, I just have to go out into the world and find friends, all of a sudden they have very specific acts to practice those skills. So some examples of those are practicing acts of kindness, gratitude, inviting or initiating, practicing self-disclosure, practicing active listening, as well as staying open.
I was going to say, before you jump away from that one, I'd love for you to talk a little bit, or one of you guys to talk a little bit just about the visuals and the illustration and kind of how they play into the user experience.
Yeah, Caroline, I'd love to pitch that one over to you.
Sure. Yeah, we worked with college students to really understand what creative direction to take the branding of Nod. And one of the things that became clear early on is some of these kind of psychological jargon-based skills really needed a way to be represented with images that students could kind of immediately get it, but also embrace this sort of awkwardness that comes with socializing in a new environment. And so we tested lots of different things, but what really rose to the top in terms of popularity and resonance was these kind of awkward animals, we call them. They've been super popular with our users and just a kind of constant source of joy for our team to see what our illustrator, Dana Safferstein, comes up with next for these illustrations.
Yeah, thank you, Margaret and Caroline. And the other great piece about illustrations is they're very approachable and they're also very inclusive, which is something that we very specifically designed for. And Caroline also reminded me of one other very important thing, so thank you, that obviously the way we're talking about things in this webinar is very sort of science-based and psychobabbly, but we do a lot of work and put a lot of thought and time into making sure that there isn't that psychobabble in the app, that it's very relatable and feels like it's written by students for students. So jumping back to our impact pathway, our challenges very much map directly to the psychological targets of helping students take social risks So this is the act of throwing themselves into the real world. And once a student accepts the challenge, we actually use notifications so that we can do some slight behavioral nudges to ideally keep that student on track with those goals that they have adopted, or challenges they have adopted, excuse me. And then also these challenges really help students focus their attention towards others. And the reason this is so important is through our research, we learned that students, a student who is experiencing loneliness oftentimes is very inwardly focused. So what that means, if I were very inwardly focused right now, I would be more worried about, how does my hair look? Am I looking weird? Am I saying or stumbling upon my words? And that would get in the way of me being able to be at least however articulate I am right now. So in relationships, when students are so inwardly focused, a lot of times they say, I didn't really get to know that person. It just gets in the way of relationships. So this really helps them think about others contextualized. So jumping into the last key component of the app are reflections. So one thing that really rose to the top in all of our research is that how an individual processes a social interaction is actually equally important, if not more important, than the actual outcome of that interaction. A quick example, if I'm walking across campus and I see someone I sat next to in class and I say, hey, do you want to get a cup of coffee? And that person says no, cognitively or in my inner dialogue, I could say, you know what, I took a swing and I missed. I'm never going to do that again. No one's ever going to want to hang out with me. Or I could say, you know what, it's really busy. It's finals time. I'm going to give that a go another time. So psychologically, it can have very significant implications. So all of these reflections are very much grounded in positive psychology as well as cognitive behavioral therapies. A couple examples of them are helping students practice self-compassion, reappraising situations, savoring and really embracing their progress to give themselves a pat on the back, and also expressing gratitude. So to walk through one very quickly, as soon as a student completes a challenge, they're first asked to very quickly rate their mood. So did it make you feel good, stressed, happy, excited, whatever it might be? In this case, the student endorsed that this made them feel stressed. Let's say they've been trying to work up. There's going to be a sound here. I'm going to wait till the sound's over before I chat again. So the example here is if a student has been working to initiate a friendship and it's been taking some time. Our turtles really represent that friendship takes time. It doesn't happen overnight. And give yourself a pat on the back for trying. So if a student endorses that it made them feel good and they're excited, what we do is present them with more of a savoring exercise, potentially a meditation or something that they can give themselves a pat on the back so that they can really harness that momentum and continue embracing that moving forward. And this very directly maps to our psychological target of applying a compassionate lens. This is so important because we know that any human relationship is not smooth sailing 100% of the time. When throwing themselves out into the world, there's going to be some great things and there will be some challenges. And making sure students have the resilience and ability to bounce back from any potential setbacks is incredibly important. And with that, I'm going to kick it over to Margaret and Caroline to talk about testing, which is an incredibly important part of our process.
Thanks, Nathaan. So one of the things I talked a little bit about in the introduction is that Hopelab is a very science and evidence-based organization. So testing, efficacy testing, both user testing, which we talked a lot about, and efficacy testing are important parts of our process. And Caroline's going to walk us through where and how NOD has been tested to date.
Thank you, Margaret. So we ran a randomized controlled trial of a beta version of our NOD app at the University of Oregon in the fall of 2019. And what we really wanted to understand was, is NOD hitting those targets that we built it to? So we looked at measuring loneliness using the UCLA loneliness scale, and also depression, which is using the PHQ-9 scale. We were interested to see if students that use NOD reported lower loneliness and depression, but also in particular, if students who were at greater risk at the start of the school year, so they were maybe more vulnerable coming into the school year because they might have had higher levels of depression or loneliness, and if using NOD made a difference for that group of students. So we recruited 220 first-year students right at the start of the school year, and half of those students were assigned to receive NOD right away, and then the other half were assigned to a waitlist control. And it's really important to us. We wanted to recruit a diverse group of participants. So we really looked at the distribution of race and ethnicity in our sample, and we're able to recruit 47.1% of our participants were non-white students. And also we were able to get a fairly good gender balance with 59.3 of the students being female. Our main analysis, as you could see, given this waitlist control design, was at 4 weeks. So we were, as we were getting the data and just really curious to know at that 4-week mark, are we seeing a difference in those key measures of loneliness and depression? Drum roll. Next slide. And I am happy to share that we did. NOD showed that it is buffering the most vulnerable students from mid-quarter loneliness and elevated depressive symptoms. Of course, this is initial promising efficacy, but we're really excited, especially given so little is known about intervening on loneliness for this age group. We have an abstract that you are welcome to check out. It's actually live at the APS conference virtual poster session, and it's free to attend. So you could dive into the details of the research and the analyses there. So I'm going to hand it over to Nathaan because we also asked students directly what they thought about NOD after having used it.
Thank you, Caroline. And that's such an important point in all of this, and that of course we want to make sure we have an app that works, and we're so proud and excited that our 2-year research process got us there. But we also really want to make sure that students want to use this thing that we make. All too often, again, being a clinical psychologist, we see interventions that are made, and unfortunately they collect dust because they didn't have that user experience in mind. So with that, all that work and the illustrations, as we were talking about before, we can see from these quotes that it's really resonating with students. So students saying that it's really calming, it's helping me step outside of my comfort zone, it's helping me think of ideas that I wouldn't have been able to do on my own. Really targeting first years, making sure that they feel like it's a tool that is specifically designed and applicable for them, because that's a unique phase, as we talked about early on. And then we're also very excited to be able to see that this app is also helping students relieve stress. It's not just doing the one thing that we helped with, it's helping the students' overall mental health. So just to couch everything in time, we did our research in the fall of 2019. We got this great efficacy. In spring of 2020, we started piloting it at several campuses. And I'm going to turn it over to Caroline to share a little bit more of that part of the story.
Well, we all know the next part of the story because we're living it. COVID-19 struck, and we were in our second pilot site, that is the University of Colorado, Denver. So we had launched NOD on that campus and a full marketing campaign with posters, digital ads, social media blasts through the university accounts. 4 weeks in, COVID hits, and the campus shuts down. So immediately our user base is wiped out, and our tips, which encourage in-person social interaction, were actually kind of contraindicated given the public health directives around social distancing and shelter in place. But at the same time, our team recognized that at this moment in time, students' need for social connection was as high as ever, and also their risk for loneliness was as high as it had ever been. So we had to face this decision. Do we just set our work aside until normalcy returns? Good news, we decided not to do that because normalcy seems like it could be a while if we were waiting for that. And we actually took the decision to pivot and adapt NOD to offer tips that help students maintain social connections even from afar, even while adhering to public health directives. So we launched a free, publicly available version that's in both the Apple and Google Play stores. Check it out. And that gave us a chance to kind of keep learning about how young people are engaging with the tool and what they're going through at this moment in time. So since that April launch, we've seen over 3,000 downloads. We've seen close to 4,000 challenges and reflections completed. And also, we're seeing some really positive feedback in our App Store reviews. We have 32 5-star reviews across the App Stores. And we're learning a lot during this time to help us inform our campus launch in 2020, which Nathaan is going to talk about.
Great. Thanks, Caroline. And as we all know, COVID threw such a wrench in all of our worlds. It was amazing to be able to react and be able to support students in this very unique landscape. And now it's really given us the confidence and the confirmation that launching at the campus level is really an effective way to get NOD in the hands of students. So with that, I know we didn't explicitly say that, but we have that research insight from the onset. And that's why we researched at a university, we were piloting at a university, and we're very excited to now transition back as an enterprise solution for the fall semester of 2020. One other very important learning we got is we know campuses and learning environments are going to look very different campus to campus this fall, with some being in person, some taking a hybrid approach, and some being fully remote. So one very significant learning that we have and product sprint that we're doing is adapting the app to be able to be flexible for those three conditions, which we know is going to be invaluable because there's also a chance that some campuses start in person and then have to pivot to either a hybrid or remote learning environment. So what lies ahead is a lot of things for NOD, but most excitingly, we're really ready to get those early adopters for a rollout of this new NOD 2.0, if you will, with this ability to be flexible in terms of learning environments. And we're also working out some further evaluation and testing. Obviously, COVID leads to a very unique time in terms of doing randomized controlled trials, but that doesn't mean that we can't get a lot of insights about how students are using the app, how to make it better, and how to make sure it sticks to get the health outcomes that we want. So if anyone's interested in staying up to date, which I very much hope you are, you can go to heynod.com and sign up for our newsletter. We won't be spamming. We'll just be releasing any major insights. When that research gets published in a peer-reviewed journal, we'll share that. So please feel free to sign up there. And we also do have a virtual booth in the conference virtual hall, if you will. It would have been great to do some live Q&A right now, but obviously that isn't an option. So please do what you can to swing by there, and we would love the opportunity to chat with you.
Great. Thank you, guys. That was fantastic. I hope, and I know there will be lots of folks here interested who will want to learn more about NOD. So in this virtual world, again, I want to thank you all for being here. I want to invite you to visit the virtual booth. Come on over, and we'll do our best to answer questions there or anywhere else. And as Caroline mentioned, visit heynod.com to learn more. We're really interested in hearing from and talking with anybody who might be interested in implementing NOD at a school, potentially sponsoring NOD at some of the schools that would like to have it but can't afford to bring it on board this fall, and just in generally hearing your feedback. So join me in thanking Nathaan and Caroline, and thanks to all of you for doing this session with us today.
Thank you.
Thank you, everyone.
Thanks,
Take care.
Bye.